But what I want to point out to you is they're making medical decisions. This insurance company is actually weighing in and disagreeing with a doctor who made a medical decision to admit this patient for her safety. When a doctor or facility treats a patient above the recommended level of care, we cannot cover it. What the heck?
That's the point. Pulmonary embolism, by the way, can be fatal. They're denying, and they're telling the doctor, yeah, we disagree.
Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up.
Hey, it's Jordan with Status Coup. As Luigi Mangione, the alleged shooter of United Healthcare CEO Brian Thompson, awaits movement in his multiple criminal cases, a proposed ballot measure has been put up on the table in the state of California in honor of Mangione, one that, if it went through, would severely restrict for-profit health insurance companies' ability to delay and deny necessary life-saving health care. Let's show you the proposed ballot measure, which still would have to be approved to be put on the state ballot in California. Luigi Mangione-inspired ballot initiative targets health insurance denials. A proposed California ballot initiative, informally named after Luigi Mangione, the alleged assassin of United Healthcare CEO Brian Thompson, aims to bar insurers from delaying or denying doctor-recommended procedures or medications. The filer, retired attorney Paul Eisner, told Newsweek in a phone call on Sunday that he used Mangione's name to bring, quote, attention for it, which it definitely has. He added that, quote, too often carriers don't want to do things, and said the initiative is aimed at changing that and making sure that, quote, carriers, meaning insurance carriers, are doing what they're supposed to be doing. Eisner, a retired attorney with an active legal license, filed a ballot initiative with the California Attorney General's office that states, quote, no insurer may delay, deny, or modify any medical procedure or medication recommended by a treating or attending physician where the delay, denial, or modification could result in disability, death, amputation, permanent disfigurement, loss, or reduction of any bodily function. The proposal, which he requested be named the Luigi Mangione Access to Healthcare Act, was received by the Attorney General's office on March 26. It's currently under review, and Californians are able to give feedback and comments on the proposal over the next month. So if you're watching in California, you could go to the Attorney General's office and give feedback under ballot measures. The Attorney General's office determines the official title, and Eisner told Newsweek he expects that Mangione's name will be dropped, quote, and I don't have a problem with that. The proposal also, quote, requires any decision to deny what a physician recommends has to be made by a physician, Eisner said, noting that, quote, a lot of times cases are either handled internally by insurance people and not physicians. The proposal makes it a felony to employ someone who is not a physician to review a decision made by a physician. Eisner said the proposal was partially inspired by his own healthcare experience, having rectal cancer 15 years ago. He said about Mangione, quote, I don't support his method. The point he is making is correct, but this is not how you do it. You do it through the political or legal process. Quote, he did not do it that way. You don't go out and conduct an assassination. Quote, delay, deny, and depose were written on the bullet casings found at Thompson's murder scene. The words are believed to be related to and inspired by the book Delay, Deny, Defend, Why Insurance Companies Don't Pay Claims and What You Could Do About It. So Eisner told Newsweek he has gotten a slew of emails related to the proposal, many unhappy with the use of Mangione's name, some supporting the idea, and some believing it'll drive insurance carriers out of California. So California, by the way, infamously, who killed CalCare, the single payer that could have passed in California, if not for corporate fraud. Gavin Newsom, who's already angling to run for president as a Democrat in 2028, him and his Democratic Party stooges in the state killing it. But I think what's important here, and there's more to it, forget the fact, yes, it's controversial that Luigi Mangione, his name is in the proposed ballot measure. If it went through, of course, they're going to change it, meaning the state of California. But obviously it got attention. there's news articles about it because Luigi Mangioni's name is in the headline. Probably wouldn't have been news articles about it if his name wasn't in the proposed title for the ballot measure. Probably wouldn't have even been covered. But I have spoken with doctors since the murder of Brian Thompson and my coverage of this. Time and time again, we have shown you how insane it is that doctors are telling the insurance companies this is medically necessary, whether it's an MRI, a mammogram, surgery, an overnight hospital stay. And the insurance companies are responding, yeah, we don't think so. Not doctors responding, yeah, I don't agree with your medical opinion from a doctor second guessing it, but non-doctors, basically suits at insurance companies saying, yeah, we disagree, doc. That's crazy. That's crazy. Would you have an accountant, sitting in on your open heart surgery, directing the doctor? Yeah, no, don't use that scalpel. It's insane. So I do think it's very, very good that this targets and tries to restrict the use of non-physicians to be reviewing claim requests or issues of claims by doctors. Non-physicians should be nowhere near the process. Bureaucrats should be nowhere near the process. Only doctors should be. And then we need to look into what kind of doctors are reviewing it, because we know with the oil companies and the fossil fuel companies, plenty of times they have chemists and scientists on their payroll that just rubber stamp whatever the company wants. So we can't just have company doctors, who basically have a medical license, but just do the bidding for the insurance companies. You need independent doctors, yes, getting paid, but are not just doing the bidding and giving the for-profit predatory insurance companies the answer that they want. And why is this important? Because of horror stories like this. Remember that doctor, Elizabeth Potter, who infamously went viral. She's a doctor down in Texas, and she went viral because she did a video about how she got called out of surgery with a breast cancer patient because United Healthcare had to talk to her right away. And then they wanted to deny what she submitted. She submitted overnight hospital stay for her cancer patient who was mid-surgery. United fought her on it. They denied the overnight stay for that cancer patient. And then after she went viral, they hired a high-priced law firm that specializes in defamation to send her a 7-page letter threatening her and trying to put the fear of God in her for her to take down her video and apologize to them. The good doctor basically told them to go piss off. Thankfully, she had the courage to do that. Well, she has another video. This time, wait till you see United's latest immoral for-profit shenanigans. This denial is truly sickening. Let's take a look.
Hey guys, I think we all knew this would happen. I had another patient come in and share with me that United denied her inpatient stay. So this is a patient who had shortness of breath and some chest pain, and she just knew that something wasn't right in her body. She had a family history of blood clots, and she'd had a deep flap surgery a couple of weeks ago. She went to the hospital and they saw her and they found that she had a life-threatening condition known as pulmonary embolisms. So she was admitted to the hospital and taken care of really well by the doctors there, and they ordered all the right things. After a couple of days, she was discharged. She got a letter from United Health explaining that they didn't agree with the level of her care and that they would not cover it. So I'm going to share some of the language of that letter with you. And I want you to know that my patient that we talked about previously who had her surgery denied had almost exactly the same letter shared. So there's some troubling things in this letter. I think this term is really interesting. United is saying they reviewed the request for inpatient admission. So let's all just pause and consider that. This is a woman who was in the emergency room with pulmonary embolisms, and the doctor wasn't really requesting anything. They were saying this patient needs to be in the hospital, but an insurance company sees this as a request, and that's part of this prior auth environment that we're living in. So I think it's important as patients and as physicians to just acknowledge that this is our reality now. Someone can think that there's a good medical decision for you and can write orders and want to do the right thing for you, but your insurance company is seeing that as a request and deciding whether or not they want to do it. One of the criteria that this insurance company used to decide whether or not to accept or deny this request was whether it's medically necessary. And it's so interesting that we're letting insurance companies and the doctors who work for insurance companies determine what's medically necessary, and not just the doctor doctor in front of the patient in the emergency room. So this is a really bold statement from United for my patient. They say, you did not have to be admitted as an inpatient to the hospital for this care. I think we all need to just reflect on that. An insurance company is telling a patient and her doctor that they disagree with the plan of care to keep that patient safe. Know that this is boiling down to whether it's an inpatient admission or an observation admission, and that's really about money. But what I want to point out to you is they're making medical decisions. This insurance company is actually weighing in and disagreeing with a doctor who made a medical decision to admit this patient for her safety. So this specific sentence: when a doctor or facility treats a patient above the recommended level of care, we cannot cover it. What the heck? That's what we do. We go above and beyond as physicians. It's clear that insurance companies don't, and they're actually saying it here.
That's the point. Pulmonary embolism, by the way, can be fatal. They're denying the claim for a patient with a pulmonary embolism. And they're telling the doctor, yeah, we disagree. Even though we're just bureaucrats, we're just pencil pushers, and our literal marching orders: deny, deny, deny. So obviously this has fallen out of the news with, Trump and all the craziness, but we're keeping it in the news because nothing has changed and nothing has improved about the predatory for-profit health insurance industry and scam. I want to also give you an update. I covered last week updates in Mangione's case. Specifically, there was a back and forth between the New York City district attorney and Luigi Mangione's defense attorneys in New York, specifically over whether he could have access to a laptop to review evidence while he's detained in the Metropolitan Detention Center in Brooklyn. The New York district attorney, Alvin Bragg, and his office have fought against Mangione having access to a laptop, even though he wouldn't be able to surf the internet or do anything other than review surveillance footage, review footage that's pertinent to his case, because they claimed he would be able to identify potential witnesses and somehow get that out of the jail, get witnesses' identities out of the jail to his cult following. Well, this came at the end of last week. Luigi Mangione may get a laptop in jail to work on his defense in CEO murder case. A judge cleared the way Thursday for Mangione to get a laptop behind bars if his jailers agree, so he could examine documents and other material in the United Healthcare CEO murder case. New York State Judge Gregory Caro wrote that he had no objection to Mangione's request for the evidence, which would be configured to allow him only to review case materials. But Caro noted that it's ultimately up to federal authorities who oversee the lockup where Mangione is awaiting trial in the December shooting death of Brian Thompson, the 50-year-old head of the U.S. health insurer. So basically a judge has no problem with it if the feds allow him to have access to that laptop. I don't know why you wouldn't give him access to the laptop. Obviously, you have a right to defend yourself. Because he's being held in federal detention, there's limited access and hours for when he could consult with his lawyers. So when he can consult with his lawyers in person, that's precious time, and they don't have enough time to go through what, from all reports, is a avalanche of surveillance footage and whatnot. And this notion by the New York City district attorney that if you give him access to this footage, he could identify witnesses, fart their identities out of the jail to his supporters. How would he be able to identify random people on the street and who they are? I mean, it's just preposterous on its face, but this is kind of the legal back and forth going on with this case. As I've reported extensively federally, his case has been bumped several times. It looks like if we're going to rank which one might go to trial first, it would be the state of New York against Mangione. But federally, there has been a delay as both the defense and federal prosecutors have agreed to an extension that will see his first court date and the potential federal indictment, because he has not been indicted federally yet, could come April or May, we would think. But he has not received a federal indictment yet, which I think is important. Also, you would think if the feds have him dead to rights, why would they keep agreeing to an extension that the defense has been asking for? The defense is asking for an extension because they have not gotten the full amount of evidence through the discovery process from either the state of New York prosecutors or the feds. So we'll continue to monitor this. As far as I know, we're one of the only outlets still covering it extensively because, as I've always said, this is not just about one person. It's not about Luigi Mangione. It's about the entire predatory for-profit health insurance system. So please support us if you can for as low as $5 a month. StatusCoup.com/join.